to India TV. I am Shivangi and you're watching HealthDNA. Well, today we are going to talk about a serious topic, that's cancer. It is a term that instantly triggers fear. Cases of cancer are rising rapidly in India, and you must have heard many celebrities and influencers, they are battling with cancer. We often think about, is it our lifestyle, the diet we have, the stress we live with, or is it our digital habits that put us at risk of cancer? So to separate the myths from facts, to answer all our questions, we have with us Dr Aditya Sarin, consultant of medical oncology from Sir Ganga Ram Hospital. Sir, welcome to India TV.
Thank you for having me here.
Sir, to begin with, I would like you to inform our viewers about what is cancer and the difference between benign and malignant tumors, because these are some very basic details that everyone must be aware of.
Yeah. So you have rightly said that cancer, as the word comes to even in a conversation, everybody just gets depressed and it takes a toll emotionally and physically. But every time anybody is saying cancer word, I want to say one thing, that there are a lot of treatment, good therapies are there. If things would have been happening in the past 35 years, I would have agreed with the thought process. But now cancer is becoming more and more like a chronic disease, and cancer can be cured. The second question that you asked, that what is benign and malignant? So whenever you have cells in the body which are multiplying regularly and are kept under check. So in a very layman term, if you have a car and if you accelerate the speed beyond a certain limit and your brakes fail, what will happen? You will land up in a crash. So the same thing happens with the cell cycle. Either the cells multiply very rapidly, or they have some accelerators to it, or the braking system goes away. That causes the dysregulation of the cell cycle, ultimately leading to unchecked proliferation of the cells. So that is in very crisp form. Now, when the cells are multiplying in one particular site and they just grow in size, that term is known as benign tumors, which they rarely metastasize. They don't have any power to go to the nearby or any adjacent organs. Vis-a-vis, if we look at malignant tumors, so tumor grows from one site, it can spread to the nearby organ or the lymph node, and it has the potential to spread anywhere inside the body, and that is where the term metastasis is coined, where from the primary source it has spread in rest of the body part. So we want to catch it as early as possible in the malignant side, and for the benign side, I think even simple surgeries can be done to cure the patient.
So as you said, early diagnosis is important. I would like to ask you about the signs and often overlooked signs that are the early warning that people skip. They don't understand or they don't know about them and they must be aware of.
So, one answer is not going to fulfill this, answer. One statement is not going to be enough. So, I need to break it down in bits and bits. First of all, we have big problem in India that whenever a patient is going and showing to doctors, so first problem is that patient is not aware of any signs and symptoms.
Right.
And the second thing is, and if you are not going to an oncologist, the other doctor might not be aware of the what can be potentially cancerous signs and symptoms. That causes both of them to be not in a zone where they are going a diagnosis towards cancer. For example, if I go and show to a chest physician or any general physician that I have a cough and it's been there for past 2 weeks and it's not going away. So the natural instinct of the other doctor is to to rub just slide it and just give some medicines in order for that let's see after 1 week what happens, and we'll review it after 2 weeks, do some investigation. So something like this happens, and the other doctor is also sometimes not fully confident to say cancer in the up-go, even if the signs and symptoms are there.
They don't say it in the first go.
Absolutely,
right?
because you don't say divorce when you are getting married. You want to live a good and healthy, prosperous life. But at the end of the day, I want to highlight is that any symptom which is unchecked and it is bothering you for long duration, at least get yourself checked up. If I were to go organ-wise, from head to toe, if you have any, white patches or red patches in your mouth, again, if you are a long-term tobacco or a smoking abuser, you need to get it checked. It's not normal. Those white and red patches are not supposed to be there. If you have cough and you have intermittent episodes of bleeding in cough, so then that means that you can have cancer as well. I'm not saying you are going to have cancer, but then it's an alert point.
Yeah.
Any lump in the body, for females, I would like to say that any lump in the breast, which is increasing in size, again, both can be there. It can be a benign lump or it can be a malignant lump. But you need to get yourself checked. Any, dysregulated uterine bleeding, where, most of the females, they know about their cycles. But if you have, dysmenorrhea and after the age of 50, after the, let's say, menopause has happened, get yourself checked, because that is the earliest, you can go and present to a doctor. There are a lot of other symptoms like fever, weight loss, and, loss of appetite, and night sweats, where we call them B symptoms. So they are technically triggered for us in a clinical scenario for lymphoma. So the list keeps on going, but the most important symptoms are like this, and you and the doctor both need to be on alert side that if you are having this, you need to think about cancer. What generally happens is that most of the patients are getting treatment for either tuberculosis for lung or TB for lung, and then once they land up, it turns out to be malignant, and at that point of time, sometimes we can't help them.
Yeah. So early diagnosis, and plus any symptom, any sign which persists for a long time.
Absolutely.
That
so
needs to be
any
checked.
lump, any abnormal bleeding, you have seen a lot of moles can be there in person's body. So if any change in the size or symmetry of the mole, you need to get yourself tested. Any lump in the body, you can't ignore it, because these are silent.
These are silent.
These are
signs.
silent.
Yeah.
So cancer is a silent killer. 90% of my practice patients are coming to us in an advanced stage disease because of the lack of awareness. And if we switch our setup from India to any Western, because of the awareness at the community level, they are making sure the diagnosis happens at the first stage or the second stage.
Yeah.
And their stage 4 numbers are way less. So I think early awareness, both at the level of the community and at the physician level, they are mandatory.
So moving on, a lot of people associate cancer with genetics. People have this, they make the statement that nobody in my family had cancer, so I'm safe. So is it a true fact or is it a myth? I mean,
so it's not, to answer it in a very simple way, you are right and you are wrong.
okay.
10% of cancers can have genetic predisposition where family history is positive and you are landing up with cancer of the same type, like breast cancer, ovarian cancer, pancreatic cancer, or prostate cancer. If you have family history, there is still a 10 to 25% chance that you can land up with those cancers. But then again, 80 to 90% of cancers are not genetically linked. They are sporadic. One statement will not be enough to emphasize that. If you are not having any family history, that doesn't mean that you are not going to have cancer. You are still predisposed to so many other factors like environmental factors, air pollution and chronic stress. I think this statement in itself is wrong, but we Indians, we keep on hope, we keep our hopes alive.
Yeah.
So even if you don't have a family history, you can still get cancer.
Okay, so one myth has been corrected, or as Sir said, both things are there. It is a myth as well as a fact as well, but yes, we have to be totally aware of it.
So, most of the times when patient come to us in OPD, the first question is this, that nobody in my family, even my grandparents, they never had such kind of a disease. But situation has changed, things have evolved, and because we don't know what is the real trigger for cancer, we are still researching, the treatment landscape are still modifying. That is why you need to be alert. Just because there is no family history and you are not going to get cancer, that should not be overlooked upon.
Yeah, right. So we cannot overlook any of these signs and symptoms. We need to be aware.
Yes.
That's the main thing. Now, if you talk about India, cases are rising rapidly. What do you think is the reason behind this?
So if I were to go into a little bit of stats, let's say our latest data set is from a Globocon registry which released their data in 2022. So that means 3 years back.
3 years back.
Then at that point of time, then again, the 3 most common cancers in India is like, breast cancer and cervical cancer, then head and neck cancer. So these are the 3 most common cancers. you'll be surprised that even that registry is showing case number to the tunes of 2 lakh or 1,40,000 or 1,20,000. I am sure we need better way of registration in order to give you the exact number. The problem is much higher.
You mean the cases are still hidden, kind of?
Most of them, they don't get reported.
Yeah.
And sometimes just because of the taboo or stigma associated with disease in tier 2 or tier 3 cities, they just don't take their family members to get treated with the doctors. So I have seen completely neglected patients in our OPD, and you will be surprised which we could have identified it in the stage 1. They landed us with the stage 4, and unfortunately at that point of time we were not able to help them because of the stigma that if we are going to treat it, something bad will happen. So there are like n number of myths that if I do biopsy, cancer will spread. If I even touch the tumor, cancer will spread. But the intent should be that if you don't do the biopsy or the analysis or the FNAC, we oncologists will never be able to start the treatment.
Yeah.
There are only few cancers where we start treatment irrespective of the biopsy. But you need to, for me to give you a treatment, I need to know what type of the tumor I'm dealing with.
Yeah.
And because of these myths, patient, they take more advices very late in their journey of the disease. When we are in an institute like Ganga Ram Hospital or any big institute, we tend to encounter the later part of the disease. But if I were to go back in tier 2 and tier 3 cities and I talk to common people over there, I am sure nobody is interested in talking to me regarding cancer symptoms. Here I have family and friends, relatives asking me questions, bang in, bang out. But when I go to tier 2 and tier 3, I don't see the same level of curiosity over there.
There needs to be awareness.
Absolutely.
So, if we talk about today's generation, what are the lifestyle changes you feel is putting us at risk of cancer?
So, let's say if we go back 20 years before India became an industrialized nation and before globalization happened to us, I think the word cancer was unheard of, and you used to hear like my grandparents, somebody's relative had it. But now you see the doctor's family member, they are also experiencing this disease within the family, let it be the community. I mean, we are seeing more and more of cases. So definitely something has changed since then. So if I were to go back 20 years and I have seen that transition, you see that more and more of factories are being set up. More and more of pollution is being created. More and more of processed food is there. More and more of alcohol consumption. Smoking, both smokeless tobacco or smoked tobacco. Consumption has been on rise constantly. And also with the better lifestyle, we all are living a long and healthy, longer life as well. Earlier, some war used to happen or some, disaster used to happen. So life expectancy was not that much, like maybe 50 years or so. But now we know that people are living beyond 75, 80, and that's why cancer, which earlier was a disease of older age, now it is there in younger age group as well. So it's a myth now that cancer belongs in the older segment. No, even babies are having cancer. It's all about when you pick up that disease. It's that important.
So what are the tests that you would like to inform our viewers about, especially separately for males and females, that they must undergo to find out if they're dealing with any of this, or to find out the symptoms? Absolutely. And all?
So, if I were to say to identify all the 130 billion population we have, I think it's going to be, we don't have the infrastructure. If I recommend everybody to go and get yourself checked, it's not possible. Yeah. So, we find, ways, and we find that particular risk of population that requires an aggressive screening. For example, if any person is taking some tobacco or supari chewing for past 5 years or 10 years, so they need to get themselves checked with an ENT specialist or an ENT surgeon to know whether the oral cavity is fine. Because see, head and neck cancer is troubling in males. It's number 1 in males.
Right.
You go and see any movie, there is a TMH patient, they always flash, and that is the way of how we can create awareness at such small level. then you see that if any female is, let's say she's more than 40 years and above, so if they have any lump, or irrespective whether they have lump or not, they can go for an early mammogram. If there is a family history, we can start screening with the breast MRI as well. So symptom defined, I think investigations can be done. For males specifically, I think oral cavity cancers we need to look out for. Any patient or any individual who is smoking more than 20 pack years or who have left smoking in the past 15 years, they can go for a low dose CT scan, and from the age of 50 to 80 years. And then if we were to see in females, then obviously mammogram is one way for females who are more than 40 years. Then patients who are like 30 to 65 years, you can screen yourself with pap smears.
Okay.
That is important in terms of cervical cancer, which is one of the cancers. If we find it early, we can cure it even before it happens. So the screening is very important. Pap smear, nowadays we have HPV DNA testing as well, because of which we are able to further risk stratify who are at high risk of getting these cancers. So these are most common ways of finding one particular type of cancer in the screening process. So screening, by word screening, means that cancer has not developed or there is no signs and symptom, but you can still identify whether something wrong is there or not. But if any symptom is unchecked, it should be evaluated in terms of oncology perspective as well.
Okay. So now moving on, as we know right now, very recently, PM Modi also highlighted that obesity in our country is a public health concern. Do you think that obesity is also somewhat linked to cancer?
So I think I'll say it in a very historical way, that just see your photograph 20 years back and all the individuals standing in that photograph. Everybody is lean, thin. And now if I go outside my OPD chamber, everybody is, or even I go to airport, any mall or shopping area, everybody is having a good amount of pot belly.
Yeah.
So obesity has definitely, it is there now, and it is more evident now with the directions from the government of India recently. And I think consumer awareness is very important, that whatever you are consuming, you need to know about what kind of calories you are taking, what is the nutrient in that particular food. You see, if you are taking a fast food, you don't know about any calories. You go to any shop or vegetable centers where they are preparing foods. This kind of caloric or micronutrient or nutritional information, it's not displayed.
Yeah.
It should be displayed, and it should be made mandatory. At least one should know that I am having this much of carbohydrates, fat, proteins. At least the content should be made. Then a conscious decision should be done at the community level. What I feel that the huge amount of alcohol, huge amount of smoking, and a rampant easy availability of food with the a delivery fast food apps you can now order food in like 8 minutes.
Yeah.
With this, what you are creating is a niche for us to not go outside. And that is one of the reason that our generation is experiencing. Even with the advent of better technologies, we are going to see more and more obesity. And obesity is not a problem for adolescence or adulthood. You see in the schools as well.
Yeah.
Even
small
you see
kids even.
Small kids are also they have weight beyond their certain limit of age group. So I think if we were to know that what we are consuming is having this amount of calories and this is the average intake should be there as per the age, I think we can definitely deal with obesity, and Government of India is trying their best to achieve that goal.
Sir, apart from fast food, our generation is also, addicted to social media.
Yeah.
Excessive screen time, Netflix and chill, that are all the terms, binge watching, etc.
Absolutely.
So are these also, factors that not directly but indirectly, do they also, are they also linked with cancer?
So, okay, let's create a scenario that if you were to watch Netflix, what will you do? You will call some company.
Yeah.
You are not going to watch it alone. And even if you watch it alone, you are going to definitely have a Sprite or, a soda beverage along with that. you are going to order snacks.
Yeah.
You will definitely order dinner or lunch after completion of that episode. And you are not going to do any work for the next 3 hours. And if you are watching a binge series, definitely for 8-9 hours, you are not going to do anything.
Yes.
But what you have done parallelly is you have arranged a calorie excess food for your body.
Yeah.
Your body is constant to the screen. You are eating and you're just putting everything in your body. But there is nothing you are doing which is going to burn away that calorie.
Yeah.
What will happen eventually? You will become obese.
Yeah.
Obesity will again, cause chronic inflammatory stress. And that has been documented that females who are obese are at high risk of breast cancer, ovarian cancer, endometrial cancer. And in fact, in males as well, it has been linked, shown with the pancreatic cancer as well. If you can't burn enough calories, kindly don't consume enough calories. If you can burn and manage your weight within the ideal, body weight, and I think you can do whatever you want. So it's not a direct relation, it is an indirect relation. Cancer causing mechanisms are there in our body, but our body keeps a tight check. When I said breaks in the first segment, I did tell you regarding that our cells know that these are the bad cells and these are the good cells. For any bad cells to replicate, if the break is good enough, then the cell division stops and the new cell cycle starts. But if that break goes away, again, it has tendency to land up in cancer. So chronic stress, chronic exposure leading to a chronic stress can lead to some biochemical alterations in our body milieu, which can ultimately lead to cancer.
Okay. So excess screen time, is it also linked?
So if you are at if you're looking at screen, I don't have any direct correlation with that. Again, it's an indirect correlation that if whatever you are watching on the screen, if it is causing a stress, it can further escalate the cycle of oncological pathways. But then again, you don't have any hard line proof to say that if I watch 2 hours of screen, I'm going to get cancer. It's not like that. If your screen time, along with some other factors, your food habits or your environmental factors, I think you have the right cocktail to have cancer. In fact, you are smoking while watching screen time again.
That is going to...
Because then you are smoking around your circle, people sitting besides you are also smoking. That is known as second-hand smoke exposure. So I think there is no one way answer to this, but yes, it can definitely cause cancer in indirect.
So similarly, a few years back, theories came out that mobile radiation also causes cancer, and we should keep phones on table or far away from us while we are sleeping, so that we are away from the radiation because it causes cancer. So is it also like a...
Let's say if this statement is true, then what's the world population right now? It must be in billions.
Yeah.
Then everybody is going to have cancer then. फिर तो सारी फिर rest of the diseases are going to go away. It's only cancer, and cancer is going to be there. Again, there is no direct answer to where I say that okay, radiation is going to cause cancer. But if you feel in your mindset, if it is there and you feel you sleep better at night knowing that you have put your mobile phone away, kindly do that, because I don't want unnecessary stress.
So stress and anxiety, all of that is indirectly somewhat becoming a risk factor for cancer.
So cancer is not one word.
Yeah.
It's a multifactorial etiology is there. I will never be able to say that if you do this, you are not going to get cancer. I can tell you how many more ways can be there to prevent a cancer. You improve your sleep cycle. If you are sleeping less than 7 hours, you are bound to get your body in a chronic state. Chronic stress, and chronic stress leads to chronic inflammation leads to more multiplying of cells, and ultimately the cancer cell cascade can happen. But it's not for everybody. You can dial down your sugary foods, you can dial down your processed meats, you can dial down on your high calorie condensed food. That way at least your body is able to burn out these calories and not store in it. So if you have a good, exercise activity planned, like even 60 minutes for 5-6 days, I think that is good amount of, energy consumption pathway to make sure, you get away from the stress which can happen because of the excess food intake.
You said 60 minutes of kind of exercise, right? Now, a lot of people depend upon walking and jogging outside. And if we talk about Delhi NCR, pollution is a major concern. People can't go outside. So I was about to come on that, environmental factors, especially pollution. How is it linked to cancer?
Well, it's linked. There is no confusion about it.
Okay.
If I am saying smoking is also causing cancer, then that means that I am saying air pollution also causes cancer. There are so many pollutants. I'm not going to name them on a national TV. Everybody has this information on their phones. And now we are living in the era of AI. If somebody believes that pollution doesn't cause cancer, then that's his belief. I can't change their point of view. For us, we all are living in Delhi NCR, and it's a very unfortunate that our generation is going to experience, and what we are going to leave behind for the next generation is going to be way worse. So you do what you can. You can take holidays, you go outside, the environment, you can use purifiers to curtain down some air pollutants.
How effective are air purifiers in that matter?
In one subgroup, I would say that is the best weapon that you have in the current scenario.
Okay.
I can't put air purifiers for the whole Delhi or for the whole city. I can't. Nobody can. The best way to tackle air pollution is for us as a community to understand that this is a major problem.
Right.
But if we all combine together, if we all combine and the policies are driven in the manner where we know that air pollution can be tackled, making sure that the regulations on the air pollution causing industries or the automobiles or any other way air pollution is happening, it should be dialed down. Why are we even risking even an ounce of pollution? If you see, Western world, obviously, I'm talking the good stories here about the Western world. They identify a problem, then they create a solution. We are unfortunately not been able to. We have, in fact, we have identified the problem, we have made a solution as well, but the implementation is very important. It has to be implemented from the ground level. If I know that my setup can have, multiple air purifiers, I'll try to give the best of the best health to my employees. At least start from there. And, I am working at an individualistic level, so I can do that. But if government is looking about the, government of India or the regulators are looking towards like factories or the water pollution, they need to kick up their enthusiasm in curtailing it. Every year it is getting worse and worse.
Yeah.
The only good thing I know is that we can change. We changed at the time of COVID, you remember? That when sky was neat and clean, there was no air pollution. In fact, the water pollution.
We were all inside our homes.
In fact, the water pollution was also handled. Yamuna was clear.
Yeah.
So COVID has given you the insight that you need to pace yourself and you need to curtain those industries or those mechanisms where pollution is happening from. Only and only then you will be able to save ourselves and the generation which is going to follow up.
Right. Now, moving on, there is one more, not one but many statements. A few years back, Navjot Singh Sidhu said that his wife could battle cancer with proper diet and meal. Similarly, actress Manisha Koirala, she said that yoga helped her in beating cancer. So again, is it a fact or a myth? What would you say? How would you, differentiate between, help us find out the hidden things here?
So first of all, I am always very grateful to Mr. Navjot Singh Sidhu that because of him, the questions in my OPD has always been about his particular diet, and I would want that, at least for my patients, if they are happy in following his diet, then obviously I don't discourage them. I tell that if it has worked for him, it can work for you. You definitely try, but it should not impact my ongoing treatment process, because if my treatment goes away, if there are treatment delays in patients who are in the curative setting of cancer, you are going to land up with more aggressive form of the disease. And ultimately it becomes very tricky for us how to handle such cases, because if you are following a certain diet, you are going to get calorie deficit.
Yeah.
If that deficit happens, you are going to feel weak. Our treatment, some of the treatment like chemotherapy, it causes weakness, but then again, in order for me to make the patient fit enough to tolerate chemotherapy session, it takes again more nutrition, and then my treatment gets delayed. So everyone who is following a diet, I have nothing against them. Just make sure your treatment doesn't get delayed. You do your aerobic exercises. In fact, if you do yoga, my patients who were doing yoga for 10-15 minutes, they did better in tolerance for the chemo, and their outcome was also better. And trust me, aerobic exercises where you increase the oxygen content of the cell's milieu, tumor microenvironment in patients where yoga was done and where yoga was not done, I think the changes are there, and definitely yoga has helped my patients.
Okay. So clean diet, yoga, they are going to be beneficial for us.
Absolutely. So let's say if I am giving you one treatment and their patients are able to follow up one segment of treatment and yoga is helping them, what else I want? Whereas in the other side, that some people make their belief that, okay, I'm only going to do yoga and I'm going to stay cancer free. Well, it's up to God Almighty, that I can't be responsible with that statement. So again, I'm again instating the fact that you need to continue your treatment in the rest of the day-to-day activities. If you want to inculcate your diet, your yoga, your more aerobic exercises, okay, please go ahead. I have no issues.
So moving on to the treatments, are there any promising treatments that are under research now, but they have, they are showing extraordinary results?
So not even in the treatment, even in the diagnosis, we are developing new and new ways to diagnosis as early as possible. We are dialing down to level of circulating tumor DNA, where only with the presence of circulating tumor cells in the blood, I can tell you whether you are having a cancer or your cancer is increasing or decreasing. We have been able to achieve that level of specificity and sensitivity now. Within the past 2-3 years, the evolution in the diagnosis have been remarkable. Not only that, in fact, with the help of blood, we are now entering in an era of MRD, which is known as minimal residual disease, where if I complete one treatment, do I really know whether my cancer has gone away? Your PET scan come neat and clean, your CT scans come neat and clean. But am I really cured? Well, for that to answer, you have now circulating tumor DNA. The cost of the technology is still a bit high, but again, as advances happen, the cost will definitely come down, and our treatment protocols will definitely change. So, not only in the diagnosis, not only in the treatment, even in the diagnosis, leaps and science has evolved leaps and bounds. Now, coming on to the treatment part, oncology is one such subject which can change overnight. You have one set of guidelines few days back, the guideline can change completely in a matter of weeks or months. For any oncologist who is preparing his journey in this field, I'm sure if you were to prepare for 3 years, so it's like 3-year residency in the oncology setup, we don't have any particular textbook.
Okay.
If you don't have any textbook, you know that it is going to change, because textbook means that something is constant. You can read it on, go in and into the text. But ours is not like that. What I read few years back, it has been into the bin now. I need to keep myself up to date and updated with the latest of the latest information which is happening around the world. It's not like diabetes or hypertension where one particular set of treatment has been evolved and we are following with that. Even there, change is happening. But our change is so rampant that day in and day out, I have to learn a new molecule, I have to learn newer injections, I have to learn newer ways of where to give chemo first, where to give immunotherapy first, where to give targeted therapy first, then do the surgery and then do the radiation. Science in the management of cancer is changing at a dramatic pace. You have now hormonal therapies with you. where you don't get any side effects and I can still treat your cancer. You have targeted therapies where only it's like a sniper shot at your cancer and the whole disease melts away. We have that in forms of tablets, we have that in forms of IV injections. We have now immunotherapy where we just boost your immune system to kill the cancer cell. That's why the side effect profile of immunotherapy is less than 10%. And melanoma and renal cell carcinoma, kidney cancer and melanoma, they have fantastic response to immunotherapy. There are more such cancers. It's there now in breast cancer, lung cancer, and colon cancer if your tumor mutation burden is high. But you are using targeted therapies over there. So immunotherapy, targeted therapy, hormone therapy, they are with us and the armamentarium is getting bigger and bigger. The next phase of evolution is antibody drug conjugate where antibodies and chemotherapy drugs are getting combined and then we are delivering that salt to a patient. Phenomenal results which were unheard of. So this is where our science is going and I think another, let's say if you and I were to shoot this again after 1 year or 6 months, I might have a different answer for you then.
Well, we hope that by that time we find that magic cure as we are moving ahead, as you say. So hopefully, moving on, sir, what would be your message to our viewers and not only our viewers, the whole India, to, stay one step ahead of cancer?
Always seek a medical consultation. If your symptoms are not getting resolved, that is number one. Do not ignore your body. Your body tells you everything. If you have a lump, get yourself screened. If you have abnormal bleeding, if you have bleeding from oral cavity, again get yourself screened. If you have sputum or cough, fever, weight loss, any abnormal lump in the breast or in axilla or in the cervical region, in the thyroid as well, any abnormal lump, please get yourself checked. That is on the part of the symptoms. On the lifestyle management, I would recommend everybody to dial down on the smoking and the alcohol consumption, increase your sleep to at least 7 to 8 hours, increase your physical activities, take freshly cooked plant-based food or a whole food, avoid all the processed food and the packaged food or the junk foods because your body cannot sometimes digest that kind of calories. So if you are, smart enough and, alert enough, I think you can technically escape from cancer.
Yes, that is a big message. If you're alert enough, you can escape from cancer. Well, I hope that all our viewers will be alert and I'm thankful that you answered all our questions, separated the facts from the myths that we had a discussion. And for our viewers, how was the interview? Do comment and let us know. If you have any questions, then do also drop your questions in the comment section. And for more such interviews, stay tuned with India TV.